Hi everybody, you'll have to excuse the lighting. We have a lot of windows in this room and this is the best I can get. But my name is Anna Keenan. I am a current extern soon-to-be graduate from Pacific. I'm originally from St. Paul, Minnesota, and I did my undergrad at the University of Minnesota in Minneapolis. I have a BA in Speech, Language, and Hearing Sciences, which is just their CSD program. And I'm currently wrapping up my externship at Sound Health Services, or St. Louis ENT, in St. Louis, Missouri. So as I said, it's an ENT clinic. We mostly see adults for hearing aid appointments, but then we see patients of all ages to do testing before they see the physicians. So when a patient comes in for a physician appointment, we are typically doing a TIMP, an audiogram, and then sometimes OAEs, mostly on children though. And then we send them out the door because it moves pretty quickly here. As far as hearing aids though, we're doing consults, we're fitting hearing aids, we're repairing, we're reprogramming, we're kind of doing everything hearing aid based. That's about it for how it goes though. Pretty settled in after a year, a little bit over a year, because I did my final internship here as well. But we were asked to share some of our experience as an extern to pass on. So I'm going to be reading a couple questions off the computer here. And the first one is, what do I know now that I didn't know a year ago? And I thought of two things here. One was all the different programmers for every manufacturer. I feel fortunate enough that we fit all of the major hearing aid manufacturers here, but at the same time, it took a long time to remember which programmers you used for everything. But if you're gonna work with hearing aids, you'll get used to it. And then the other thing is third parties. I knew next to nothing when I came in, and I feel like I can navigate that much better now, or at least do it without assistance and maybe give a phone call if I need some help. What clinical skills have I learned that I'll use for the rest of my career? A big one here, especially at an ENT, we have a lot of asymmetries or conductive losses too. So I have gotten in the habit of double checking my air conduction thresholds if I've used inserts and I get an airbone gap, because sometimes it could be due to the inserts, sometimes it's a true conductive or mixed loss, and you never know until you check again. So that is something that I'll use if I'm suspecting that it might not be conductive. Let's say that they have normal TIMPs, or they're not complaining of anything that seems like it would lead to a conductive loss. A patient I'll remember for the rest of my life. This one was probably one of the toughest counseling experiences that I've had so far. Nothing quite matches it. And I apologize, there's an airplane flying overhead if you can hear it. I think it's gone now. But I saw a patient, he came in for an audiogram before seeing one of the physicians, and he said he had a sudden hearing loss 6 months ago. And I was like, oh goodness, it's been quite a long time. I did his audiogram, he had a huge asymmetry. I had to counsel that, it's likely a permanent loss. We'll have him see the ENT, find out what happens. He was pretty devastated. And he saw the physician and their treatment didn't really help. So he returned about 2 to 3 months later and he said, my hearing dropped again. And I did an audiogram and it did in fact get significantly worse. So I had to go through that process of explaining to him once more that he's had a significant sudden hearing loss. And that was really difficult because I feel like with sudden losses, it's the one that people are expecting the least, and it happens really quickly. And it's a very emotional process. So I really had to use some good counseling skills to get through that one. Something that my preceptor has done that I really appreciate. I have 2 preceptors and they both give me pretty constructive advice without making me feel like I've messed up. So we had a conversation early on that I like feedback after the appointment's done, as opposed to during the appointment, even if I'm just doing an audiogram and we're chit-chatting while it's going on. And that's really helped me. So they give me tips and pointers and then advice for next time if I've made a mistake or done something that maybe I could have done something else for. And then one of my preceptors helped a patient get a new pair of hearing aids. So she used a promotion to get him a new pair of hearing aids. And this patient was insignia stilettos with embedded receivers. And he's had issues with them ever since he got them. And they've been going in for repair, honestly, every month or every 2 months for the past couple years. So she was able to make something work out for him to get him a low-cost pair of hearing aids that are actually going to function for him. And I really appreciate that. One mistake I've made many, but this is one that I made just last week. We do not typically see peds patients for hearing aids, but one of my preceptors did her externship at a pediatric hospital. So she has some experience and she has a couple pediatric hearing aid patients. And she did real ear on one of them the day before I did a hearing aid fitting first thing in the morning. So I bring this older gentleman in and I'm setting him up for real ear, and as I'm running it, I'm not getting accurate results. I'm changing the receiver power, I'm changing the domes, nothing's happening. And I just had to go with the first fit and tell him, we'll do it next time. And as I talked through this with my preceptor, she reminds me that it was set to DSL for an 8-year-old and not to NAL NL2 for an adult. So I will fix that next time he comes in, but that's one of the most recent mistakes I've made. So even after a year here, it still happens every once in a while. What I wish I had known before my externship, I wish I had known a little bit more about the sales aspect involving hearing aids. I knew that I wanted to work with hearing aids in an adult population, but there's so many different places that we can go and sales isn't always involved. But I learned that sales are most likely going to be involved at most clinics that I'm at. And I kind of got thrown into it and had to learn about it. I actually kind of enjoy it now, but I wish I had maybe asked a couple more questions about it before I started. And then finally, some advice to new externs. If you're in a new city, do whatever you can to go out and explore and make new friends. Here in St. Louis, almost everybody that I meet has transitioned here from a different city. So everyone's kind of in the same boat, and you find out everyone's also just looking to make new friends too. So I held off on that for a little bit and I definitely regret it, but now I have a pretty solid friend group here and I really enjoy it. And then another piece of advice is to not be discouraged if a patient comes in and you tell them that you're a student clinician. Even if you've been on your own for a while or you're not having direct supervision, they still might tell you that they don't feel comfortable seeing a student. Some of them get angry, some of them are mean, some of them are nice about it, but try not to take it personally. Some people are just not up for it, but there's a million other people who are more than happy to see students. So that's the best advice I can give there. And that's about it. I wish everybody good luck on their new externship or wrapping up their current externship.